One of the most important parts of that is what we're talking about today, which is video conferencing etiquette. And I'd like to kind of, as we go through this, have you think about two different areas. One would be clinical telemedicine, and so we would talk about, some people say sort of like website manner as a new term that people are saying. And so you think about how a provider would best conduct a video visit to care for a patient instead of being in the same clinic room with them. And then the other thing that I would have you think about is a meeting just like we're doing today, where, and we do these a lot now, but in my experience, we have a lot of people that, even though video is available, they don't join by video. And so the first thing that I would say is for video etiquette is if you are on a video conference, then the polite thing to do is to have your video on so that your presenter and everybody in your meeting can see you. It makes it, and you guys probably will agree with me because I'm sure that you're in meetings like this all the time, but it just makes it a lot more fun and more interesting if you can see the people and see the visual cues of them nodding or smiling, or you know, or they'll give you, you know, the finger like, oh my gosh, I have to step away from my desk for just a second. So you kind of know, you get that immediate feedback and you can tell what's going on. During this presentation, I would just invite you to either chat with me or go ahead and unmute and just give me, you know, I can't see everybody. One of the things that I don't love about WebEx is that you can't see a whole lot of the different boxes. As you know, we've probably got 25 people on. For some reason, no matter how I mess with it, I can still only see about 5 boxes at the top. So if you know a better way to do that, you can either tell me or chat me that too. But other video conferencing products, it's a lot easier to see a lot more faces on the screen. So that's one of the things about video conferencing etiquette is, please, if you have video, turn your video on and let your colleagues see you when you're talking. Some of the other things that I think are important, and you might not think that it falls 100% within video etiquette, is having your room ready. So both on telemedicine and in what I would consider telehealth, which is a meeting like this, you have to think about how you're dressing, what the background is in your room, what the quality of audio is going to be depending on where you are. So some rooms that are quite large and have maybe, you know, tile floors and high ceilings, you're going to get a lot of echoey sounds there. If you have 2 people in the same room that are both joined on the same video conferencing, one person is going to have both their speakers and mics muted, or you're going to get a lot of echoing. So all those kinds of things that have to do with the quality of the audio and the video, that's part of the etiquette. And you could either include that in your preparation list, so you're testing everything ahead of time and making sure that it works right, or have it in what I would sort of consider like a room setup. So even before you are thinking about doing telemedicine, if you're going to use a clinic room, for example, if you're going to do telepsychiatry, some clinic rooms, you can hear when people are talking. And the audio that comes through your computer or your video conferencing device oftentimes is much louder than when it's 2 people conversing in the same room. And so to make sure that you're in the privacy of the patient, in a lot of places I have seen people put white noise machines either right outside the door or right inside the door. And you can see why that would be helpful to ensure the privacy of the patient. I've seen lots of rooms where they have beautiful bright windows and the sunshine coming in, but if their back is to the window, then all that backlight is going to create it so you can't see the face of the person you're talking to. It's going to look like they're in witness protection program. So the lighting has to be situated in a way that you can see people as well. And then finally, I would think about the angle of the camera for sure. We have to think about that. A lot of times in telemedicine, we talk about the head and shoulders shot, and that's similar to when you see all the talking heads on CNN or something. They're very well positioned so that you can see their eyes, face, and their mouth. And oftentimes, I would say many times, whether it's in a video conference for education, training, or telemedicine, I often see people where they have the camera pointed at the wall or the ceiling, because many people are modest. They don't like seeing themselves on camera, and they don't want to be on camera. But I would say that it's a matter of respect, that if you're going to be doing video conferencing, that you need to allow yourself to be on camera so that the other people can see you and hear you. Otherwise, you should just maybe use the telephone for that visit. And because I'm mentioning the telephone, this doesn't quite go into video etiquette, but I think it's very, very important that you always have a backup method of communication. So any of your clinics, and I don't know where all of you guys work, but I assume that many of you might work at federally qualified health centers. If your clinics are setting up telemedicine services, in the protocol, there always has to be a backup method of communication between the provider, whether it's two clinics or a patient and a provider and the patient's at home, so that if for some reason the video conferencing technology doesn't work, well, what are you going to do then? Typically what I've seen is that it's a phone call, but you would want to make sure that something like that is written out in your protocols. I have a document that I am willing to share with you guys after, and it's a really nice etiquette document because it's framed in a way that says always, sometimes, never for when you're video conferencing. This one was created at the University of New Mexico Health Sciences Center, and it was made for teleeducation, not just clinical care over telehealth. So some of the things that we have in this, and I'll send it, Susan, I'll send it to you, and then you can share it out with everybody that's on this call. So some of the things on here, you can tell they're not exactly clinical, but a lot of them are. And so some of the ground rules that you would have your providers or your patient presenters set up when they do a telemedicine that would be listed in the protocol is always remind people that they should introduce everyone in the room. As I see some of you on video, the picture on video is fairly narrow, right? It's really just you. So if someone was off to your left or right or on the other side of your desk, I couldn't tell. And we used to do a lot of teledermatology in one of the resident clinics here at the University of Missouri. And if any of you have ever been to a resident clinic, you know that not only are there residents there, there are nurses, there are medical students, and then there are the attending physicians. And so within our telemedicine clinic, we would have the person that was operating the camera pan the whole room so that everyone could introduce themselves. Now, before we did that, we would ask the patient that, tell them that this is a resident clinic, make sure it's okay for them to know that there are going to be other people observing the visit, and get their permission to do that. But then you don't want them to not know if someone is observing the visit. It really needs to be set up the same way as if you're doing that visit in person. And that also goes, when I was helping with those visits, I noticed that because the patient wasn't in the room, they were on the television in the room, people would often just leave the door to the clinic room open. But if the patient started talking, you could hear them in the hallway. And so that's another thing that maybe you didn't think about when you think about a telemedicine visit, but you really do have to treat that visit as if it were in person. So the courtesy of closing the door to make sure that other people can't hear that conversation is very important. Are you guys with me so far? I haven't seen any questions pop up. Okay, good. So a lot of the different types of video conferencing we do set up some hand signals to make it easier, just for visual quick cues, because sometimes it takes a second for you to find your mute and unmute button. And so I always try to show people the thumbs up for yes, I agree with you, or yes. I show people the hand raise for, hey, can you pause for a second? I have a question. And then you guys might know this. Does anybody know what this means? No? It's applause in American Sign Language. So at the end of your meetings, you can do applause if you like it, or you can do a thumbs down if you didn't like it. That's fine too. And so I think having some of those visual cues set up when you're in video conferencing sessions, it helps things go much more smoothly. And I wouldn't recommend doing those hand signals in any kind of a clinical setting, but in a non-clinical education setting, I think that they make things a little bit more fun and interesting, and they keep people a little more engaged as you're going through the meeting. So some of the things, some of the other things that I talk about when I talk about video conferencing etiquette is to make sure that there's a clear sort of agenda. And when we go, any of us goes to our own healthcare provider in person, we know what's going to happen, right? We go to the front desk, we check in, we talk to that person, we go sit down, a nurse will likely come and get us and do our vitals and take us back to the room, maybe gather a few more pieces of information, and then that nurse might leave, and you're kind of waiting by yourself until your provider gets in the room. You can set up your telemedicine visits basically to be the same way, but you have to make sure that the patient knows what's going on, and they're not just sitting there for a really long time just staring at a blank screen and not wondering what's going to happen.